This animation shows how varicose veins form. Varicose veins are swollen veins that are a blue or purple color. They show through the skin, usually on the legs and feet. The superficial veins lie below the surface of the skin. The deep veins pass through the deep tissues of the legs. They transport blood from the legs and feet back up towards the heart. The superficial and deep veins are connected by perforated veins. Here we show the position of the deep veins, superficial veins, and perforated veins in the leg. The deep veins run between the muscles of the legs. Contractions of these muscles when you move your legs and ankles help to squeeze the blood back up towards your heart. Veins also have valves that prevent the blood from flowing back toward your feet. Here we show a valve and the muscles around the vein. Varicose veins are thought to be developed when the valves don't close properly. Here we show a valve in the superficial leg vein. If the valves don't work properly, the blood is able to flow backwards. Blood pools in the vein, causing the vein to stretch. This is called a varicose vein. Here we show a vein that has become varicose, which is in the lower leg. Varicose veins may cause symptoms such as aching, itchiness, or swelling of the ankles. However, often they don't cause any symptoms. The main problem is usually their appearance. If you want to watch this animation again, then click on the animation screen. And thank you so much for watching the video.